Hey everyone, ready for a deep dive into something a little bit interesting today?
Hmm.
We're going to be talking about liposuction,
Oh, wow.
and we're going to kind of really go through it. I
Good.
mean,
Yeah.
how it works, why it's so popular,
Right.
and what you need to know if you're considering getting it yourself.
Okay. Sounds good.
And our main source today is going to be a chapter from a medical textbook on liposuction.
Okay.
So we're going to try to keep it evidence-based,
Great.
but make it fun and interesting.
Yeah.
So,
That sounds like a good plan.
yeah.
So liposuction, it has a little bit of a dramatic backstory, I think.
Really?
Yeah, it wasn't always the streamlined procedure that it is today.
I mean, I always assumed it was kind of a newer procedure, so I'm curious to learn.
Yeah, well, the first attempt at liposuction was way back in the 1920s,
Oh, wow.
and it actually ended with an amputation.
Oh, my God.
Yeah. So it wasn't until the 1970s that surgeons in Europe developed safer techniques,
Hmm.
using blunt cannulas and negative pressure to remove the fat.
Oh, okay. So that's much closer to what we know today.
Yeah, much
So using these cannulas to suck out the fat.
Right.
Um, I'm guessing it's not just any fat, right?
Yeah.
Like what fat are we targeting here?
It's all about the subcutaneous fat, so the fat that's right underneath the skin.
Okay.
And that fat is organized in layers, and this is what gets interesting.
Oh, okay.
You have the superficial layer, which is closest to the skin.
Okay.
Then you have the intermediate layer,
Okay.
and then the deep layer, which is, the deepest.
Okay. So why do we choose a specific layer, I'm assuming?
Yeah, so surgeons primarily focus on the intermediate layer for safety reasons.
Okay. So like choosing the right layer of the cake.
Yeah, exactly.
Okay.
Like you wouldn't want to just eat the frosting or the very bottom layer.
Yeah.
You want that perfect middle layer.
Makes sense.
So the intermediate layer is the safest to work with, and disrupting the other layers can actually lead to contour deformities,
Okay.
especially if you're going into these areas called the zones of adherence. Oh.
Oh, interesting. So those are really important.
Very important.
Okay.
It's like the load-bearing walls of a house.
Oh.
You don't want to mess with them for structural integrity.
Gotcha. So liposuction has its own set of like architectural rules.
It does. You have to know the anatomy really well.
So what about cellulite?
Mm.
Like, does liposuction help with cellulite?
So cellulite is a little more complex.
Good.
You have two types of cellulite. You have one that's related to enlarged fat cells,
Okay.
and the other is skin laxity, which could be from aging or even weight loss.
Oh, okay.
So liposuction mainly targets the fat, not the skin itself.
Oh, okay. So it's not a one-size-fits-all.
Right.
Gotcha.
You really have to know what type of cellulite you're dealing with,
All right.
that the patient's goals are.
So for those stubborn fat pockets, let's talk about the suction itself.
Okay.
So how does vacuum pressure actually work in this procedure?
So we measure that pressure in a unit called torr.
Torr.
Torr. And basically this tells you how much pressure is being removed from the system.
Okay.
So the higher the torr, the stronger the suction.
So like a superpowered vacuum cleaner.
Yeah, you got it.
And you mentioned those cannulas.
Yeah.
Like, do they come in different sizes?
They do.
Does that impact the suction at all?
It does. So cannulas come in all sorts of sizes and shapes, and surgeons choose them based on the area being treated and the desired result.
Okay.
So a wider cannula offers less resistance, so it allows for a smoother fat removal.
I see.
Kind of like drinking through a wider straw.
Yeah.
Easier flow.
Okay, that makes sense. So bigger straw for a smoother smoothie.
Yeah.
All right, but before we even get to the main event, what happens in that pre-op evaluation?
Right. So before any liposuction procedure, you have to do a thorough physical exam
Okay.
to check the patient's overall health,
Hmm.
their fat distribution, and their skin elasticity.
Okay.
And the surgeon will also take photographs
Oh, God.
to document the before and plan the procedure accordingly.
So it's all about making sure they're going to get the right results.
Exactly.
Okay.
And it's about safety, too.
And speaking of prep, I've heard about these wetting solutions.
Yeah.
What's the deal with those?
So wetting solutions are crucial.
Okay.
They contain a few things.
Okay.
They contain saline lidocaine for pain control and epinephrine to constrict blood vessels.
Oh,
So this does a few things.
okay.
It reduces bleeding and bruising,
Okay.
and it also makes the fat easier to remove.
So it's like a multi-purpose prep step.
Exactly.
You mentioned lidocaine.
Yeah.
Isn't there a risk with that?
Yeah. So lidocaine can be toxic,
Right.
but that's where liposuction gets unique.
Okay.
Because of how we use this wetting solution and the nature of fat tissue, higher doses of lidocaine are possible than in other procedures.
Okay.
But of course, there are safety guidelines and limits to make sure everything stays within a safe range.
Right. So it's a calculated risk.
Exactly.
Okay.
With careful monitoring.
So we've got our prepped area, our souped-up vacuum,
Right.
and our high-tech cannula.
Yes.
What's next?
Okay, so,
Do we just dive right in?
well, not so fast.
Okay.
There are actually a bunch of different techniques for liposuction.
Oh, really?
Mm-hmm.
Interesting.
You have the traditional suction-assisted,
Okay.
but there's also ultrasound-assisted,
Oh.
power-assisted, and even laser-assisted liposuction.
So many options.
Yeah, it's like a buffet of fat-busting techniques.
Right, but how do you know which one is right for each person?
Yeah, so the choice depends on the individual, the area being treated, and the surgeon's experience.
Okay.
And really taking into account, their unique anatomy and goals.
Right, so it's not one size fits all.
Exactly.
Okay.
And sometimes a combination is used.
I see.
Yeah.
So can we walk through like a typical procedure?
Sure.
Like what are the basic steps?
Okay, so let's break down the process.
Okay.
First, we have the infiltration stage, where that wetting solution is injected into the treatment area.
Got it.
So this preps the fat for removal and provides pain control.
So step one infiltration, like setting the stage.
Exactly.
What comes next?
All right, so the next step depends on whether we're using ultrasound or not.
All right.
If we are, this is where the ultrasonic probe comes into play to further break down the fat, making it even easier to remove.
So ultrasound is like an optional power-up.
Yeah, you got it.
All right.
It breaks down those stubborn fat cells.
Okay, what happens if we skip the ultrasound?
So whether we use ultrasound or not, the next step is evacuation and contouring.
Okay.
This is where the actual suction happens using that cannula connected to a vacuum pump.
Okay.
And the surgeon carefully removes the fat and sculpts the area for a smooth and even result.
So evacuation is where the magic happens.
It is.
That's where the fat is actually removed
Mm-hmm.
and the body is reshaped.
Right.
It sounds like a delicate dance between science and art.
It is. It requires both technical expertise and an artistic eye to achieve those natural-looking, harmonious contours.
It's like sculpting from the inside out.
Yeah, it is.
So infiltration, the optional ultrasound,
Yeah.
and then the grand finale of evacuation contouring.
Exactly.
It's amazing how every step plays a crucial role in the overall outcome.
Yeah, it's a testament to how far medical science has come.
Right?
We're able to target specific areas, remove that unwanted fat, and reshape the body with increasing precision.
And speaking of specific areas, let's shift our focus to the different parts of the body that liposuction can target.
Okay.
We know it's a versatile procedure, but what makes each area unique? Like, what should people know about how liposuction works on different parts of the body?
That's a great question. So each area has its own unique considerations,
Yeah.
from fat distribution to skin laxity.
Okay.
So let's start with a popular target, the hips and flanks.
All right, let's do it. The hips and flanks.
Yeah,
That's like the ultimate quest for that hourglass figure.
it is.
So what makes this area so unique when it comes to liposuction?
Well, it's all about creating smooth, sculpted curves.
Okay.
So surgeons have to carefully consider the person's bone structure, their muscle mass, and how their fat is distributed.
Right.
So the goal is to remove enough fat to achieve those desired contours,
Okay.
but not so much that it looks unnatural.
Right, so it's like a balancing act.
Yeah,
Okay.
respecting those natural proportions.
Are there any specific techniques that work best in this area?
Sometimes a combination approach is used.
Okay.
So, for example, ultrasound might be used first to break down any tough fibrous tissue in the flanks.
Okay.
And then traditional suction is used to remove the loosened fat and really refine those curves.
It's like a two-step process, loosen and sculpt.
Exactly.
And what about the recovery after liposuction in this area? Is it any different from other parts of the body?
It's pretty similar.
Okay.
You can expect some swelling and bruising,
Okay.
but wearing that compression garment diligently is key
Okay.
to help things heal properly.
So those compression garments are like the secret weapon
They are.
for smooth results.
Yeah, you want to make sure you wear that compression garment.
Okay, and when can people expect to see those final sculpted curves?
Well, it takes time for the swelling to go down and for the final contours to really emerge.
Okay.
So you might see a noticeable difference within a few weeks,
Okay.
but it can take several months for the full results to become apparent.
So patience is a virtue,
It is.
especially when it comes to body transformations.
Absolutely.
Okay, let's move on to the thighs.
Right.
I'm sure many listeners can relate to those stubborn fat deposits
Oh, yeah.
that just won't budge no matter how many squats you do.
Absolutely. Thighs are another popular area for liposuction.
Yeah.
And usually the goal is to remove those stubborn pockets of fat that are resistant to diet and exercise.
Right.
Especially on the inner and outer thighs.
Like those areas have a mind of their own.
They do.
but I imagine skin laxity plays a big role here. If you're removing fat, the skin needs to tighten up.
You're exactly right. Skin elasticity is super important.
Okay.
In this area, if the skin is too loose,
Yeah.
liposuction alone might not give you the results you're looking for.
Let's see.
In those cases, a thigh lift might be necessary
Okay.
to get that smooth toned look.
So it's about addressing both the fat and the skin.
Exactly.
Okay. And are there specific techniques used on the thighs?
It depends on the location and the amount of fat being removed.
Okay.
So for the inner thighs, a more delicate approach is needed
Okay.
to avoid damaging those sensitive tissues.
Right.
But for the outer thighs, a more aggressive approach might be appropriate. So it really depends on the individual.
So a tailored approach, as always.
Yes,
And what about the recovery process? Is it similar to the hips and flanks?
pretty much.
Okay.
You can expect some swelling and bruising, and
Yeah.
wearing a compression garment is crucial.
Right.
And again, it takes time to see the full results, but the outcome can be amazing.
I bet smoother, more sculpted thighs.
Yes.
Who wouldn't love that?
Right.
All right, let's move on to the abdomen.
Okay.
That's got to be one of the most common areas for liposuction.
It is.
What are the goals people usually have for this area?
You nailed it. The abdomen is super common,
Yeah.
and people often want to create a flatter, more toned stomach
Okay.
by removing those stubborn fat deposits.
Ah, the quest for the elusive six-pack.
It is.
But I imagine it's not just about the fat itself.
Right.
What about the muscles underneath?
You're thinking like a surgeon.
Oh.
So if those abdominal muscles are weak or separated, liposuction alone might not be enough to get that flat stomach.
Right.
In some cases, a tummy tuck might be needed
Okay.
in conjunction with liposuction
Interesting.
to tighten those muscles and get the best results.
So it's like a team effort.
Yeah.
Fat removal and muscle tightening.
It is.
What about the techniques used on the abdomen?
It really depends on the individual's anatomy and the amount of fat being removed. Sometimes a combination of techniques is used
Okay.
to target different layers of fat,
Oh.
creating a more refined and contoured result.
So another personalized approach.
Yes.
And the recovery process, anything unique about the abdomen?
Recovery is similar to other areas.
Okay.
Swelling, bruising, compression garments.
Uh-huh.
The whole 9 yards.
Got it.
And as always, patience is key.
Patience and compression garments are like the best friends of liposuction.
They are.
Okay, now let's talk about the arms.
Okay.
You know those pesky bat wings
Mm-hmm.
can be so frustrating, especially as we age.
Yeah,
Is liposuction a good option for that area?
absolutely.
Really?
Yeah, liposuction can be very effective in getting rid of excess fat in the upper arm,
Okay.
creating a more toned and defined look.
It's like an arm workout from the inside out.
Exactly.
So what are the key considerations for liposuction in the arms?
Just like with the thighs, skin laxity is super important.
Okay.
We need to make sure that skin will contract properly after the fat is removed. If it's too loose, an arm lift might be needed
Okay.
to achieve those optimal results.
So again, it's about addressing both the fat and the skin.
It is.
Okay. Are there specific techniques used for the arms?
Yeah, so a smaller cannula is usually used in this area
Okay.
because the tissues are more delicate
Right.
and we want to be as precise as possible
Yeah.
to avoid any damage.
Makes sense. And what about the recovery process?
Mm-hmm.
Anything unique about the arms?
It's similar to other areas, swelling, bruising, compression garments.
Yeah.
The drill.
Right.
The main difference is that you'll need to avoid strenuous activity
Okay.
that involves the arms for a few weeks
Got it.
to allow for proper healing.
So no intense weightlifting or arm wrestling for a while.
Exactly.
But I imagine the results are worth it.
there,
Those toned, sculpted arms
It
that
is.
you've always wanted.
it can be a real confidence booster.
Right.
But remember, it's important to choose a qualified and experienced surgeon who can assess your individual needs and create a personalized treatment plan.
That's a great point. It's
Yeah.
not just about the procedure itself.
No.
It's about the expertise and the artistry of the surgeon.
Exactly. You want to make sure you're going to someone who knows what they're doing.
Right. Okay, so we've covered the hips and flanks, thighs, abdomen, and arms.
Mm-hmm.
It's amazing how liposuction can target so many different areas,
It is.
giving people the power to really reshape their bodies
Yeah.
and achieve their aesthetic goals.
It's pretty incredible.
But it's important to remember that liposuction isn't like a miracle weight loss solution.
Yeah.
It's a body contouring procedure
Exactly.
designed to remove those stubborn fat deposits
Right.
and enhance those natural curves.
It's about refining, not redefining.
Exactly.
You want to work with what you have.
So for those considering liposuction, Realistic expectations are key.
Very important.
Okay, but even with the best surgeons
Mm-hmm.
and the right mindset, are there still potential complications?
Of course. So while liposuction is generally a safe procedure,
Yeah.
it's important to be aware of the potential complications,
Okay.
just like with any surgery.
So let's get into the nitty-gritty of what can go wrong
All right.
and how those risks are managed.
Sounds good. So one of the most common complications is something called a seroma.
A seroma.
Seroma.
That sounds a little scary.
Yeah, so it's basically a collection of fluid that builds up under the skin.
Hmm.
And it can happen in any area where liposuction is performed.
Okay.
But it's more common in areas where larger volumes of fat are removed.
So it's like a fluid pocket
Yeah.
that didn't drain properly.
Exactly. So smaller seromas often resolve on their own,
Okay.
but larger ones might need to be drained by the surgeon.
Hmm.
But it's usually a simple procedure.
Okay, so it's manageable.
Yeah.
What about infection?
So infection is a potential risk with any surgery,
Right.
but it's relatively rare with liposuction
Okay.
when proper sterile techniques are used.
So hygiene is paramount.
Ah.
What are the signs of infection, just in case?
Keep an eye out for redness,
Okay.
just swelling, warmth, or pain around the incisions.
Okay.
And if you notice any of those signs, contact your surgeon right away.
Got it. Better to be safe than sorry.
Exactly.
What about those uneven contours?
Yeah.
I've heard about those.
Contour irregularities.
Are those a common complication?
They can happen.
Yeah.
So basically, contour irregularities are bumps or unevenness under the skin after liposuction.
So not the smooth, sculpted look
Right.
we're going for.
Not ideal.
What causes these irregularities?
It can be a few things,
Okay.
like uneven fat removal,
Okay.
poor skin elasticity,
Right.
or even scar tissue formation.
So there are a lot of factors at play.
There are.
Can contour irregularities be fixed?
Sometimes they can be improved
Okay.
with massage or even additional liposuction procedures, but in some cases they might be permanent.
Yikes. That's why choosing a skilled and experienced surgeon is so important. It sounds like they need to be both a scientist and an artist
They do.
to get those smooth, natural-looking results.
It's a delicate balance.
Speaking of risks, we talked about local anesthetic.
Yeah.
Are there any other anesthesia-related complications people should know about?
So while liposuction is often done under local anesthesia,
Okay.
sometimes general anesthesia is needed,
Okay.
especially for procedures involving larger areas. And general anesthesia carries its own set of risks,
Oh,
things like allergic reactions or breathing problems.
So it's a decision that should be made carefully,
Yes.
weighing those benefits and risks
Exactly.
for each individual.
Right.
What about long-term complications? Are there any issues that might crop up months or even years down the road?
Long-term complications are pretty rare,
Okay.
but they can happen. One possibility is changes in skin sensation. So things like numbness or tingling.
So like nerve damage.
It's not always permanent nerve damage.
Okay.
It's usually more like a temporary disruption of nerve signals
Okay.
that usually goes away on its own.
Okay.
Another possibility is skin discoloration. So either lighter or darker patches of skin.
So like changes in the skin's pigment.
Exactly.
And are those changes permanent?
Usually they're temporary
Oh, okay.
and they fade over time. But in some cases, they might be permanent.
Oh, wow.
So it's important to discuss these risks with your surgeon beforehand.
Right.
You know what to expect.
Right. So this all highlights the importance of having those open and honest conversations with your surgeon, making sure you understand both the potential benefits and the risks of liposuction.
Absolutely. Informed consent is crucial.
Right.
Patients need to be active participants in their care.
Right.
Asking questions and making sure they're comfortable with every step of the process.
It's a partnership.
It is.
Not just the doctor dictating what happens.
Exactly.
Wow, this deep dive has been incredibly insightful.
It has.
Revealing the complexities and the potential pitfalls of liposuction.
Yeah, it's definitely more than just sucking out fat.
Right. It's a delicate procedure
It is.
with specific risks and considerations.
Absolutely. And with any medical procedure, knowledge is power.
Right.
The more you know about the procedures, the risks, and the potential outcomes, the better equipped you are to make decisions about your body.
Speaking of informed decisions, let's shift gears a little bit
Okay.
and look ahead. Liposuction has come a long way.
Yeah.
But where is it headed?
Right.
With all these advancements in medical technology, what does the future hold for this procedure?
That's a great question.
Yeah.
The future of liposuction is looking pretty exciting.
Really?
We're seeing new technologies and techniques emerging all the time,
Okay.
making the procedure less invasive and more precise.
So liposuction is getting like a high-tech makeover.
It is.
Tell me more.
So one trend is the development of less invasive methods. For example, some laser-assisted liposuction techniques
Okay.
now use tiny incisions,
Right.
which means less downtime for patients.
Right.
We're also seeing ultrasound-assisted techniques that can target specific areas with even greater precision.
So smaller incisions, faster recovery, and more targeted results.
Exactly.
That sounds amazing.
Yeah, it's pretty cool.
What other innovations are in the works?
Another area of research that's really fascinating is the use of stem cells in liposuction.
Stem cells, that sounds super futuristic.
It is. It's cutting-edge stuff.
How are they being used in liposuction?
So scientists are exploring how we can use stem cells taken from a patient's own fat to improve skin quality and speed up healing after the procedure.
So it's like using the body's own healing power to boost the results.
Exactly.
Are there any other like futuristic trends on the horizon?
There's a lot of buzz around non-surgical alternatives to liposuction.
Really?
Yeah, so things like cryolipolysis, which is also known as fat freezing.
Okay. And radiofrequency treatments that can reduce fat and tighten skin.
Okay.
Without any incisions or downtime.
So it's like liposuction without the surgery.
Pretty much.
That sounds pretty appealing.
It is.
So what role do you see these non-surgical alternatives playing in the future of body contouring?
I think they'll become increasingly important, offering patients more options.
Okay.
And allowing us to really personalize treatment plans based on their individual needs and preferences.
So it's not about replacing traditional liposuction.
Right.
But rather expanding those options.
Exactly.
Giving people more ways to achieve their body goals.
Exactly. It's about finding the best fit for each individual.
And with all these exciting advancements in technology, I think the future of body contouring is looking pretty bright.
It is.
Offering more choices and more possibilities than ever before.
Absolutely.
This deep dive has been incredible, taking us from the history of liposuction all the way to the cutting-edge innovations.
Yeah, it has. That are shaping its future. We've covered a lot of ground, but I think the biggest takeaway is that knowledge is power.
It is.
Especially when it comes to making decisions about your body.
Right. The more you know about the procedures, the risks, the potential outcomes, the better equipped you are to make choices that align with your goals and values.
Well said. And on that note, let's move on to our final thoughts on liposuction. Okay, so we've talked about like the hows and whats of liposuction.
Yeah.
But what about the why? Like, what does this growing popularity of liposuction say about our relationship with our bodies?
Right.
Especially with all these new technologies making it seem even easier.
Yeah, that's a really interesting question.
Right.
As these procedures become less invasive and more accessible, it does make you think about how they influence our perceptions of beauty and those pressures to conform to certain ideals.
Totally. It's like how much is about feeling good in your own skin versus feeling like you need to change to fit in.
Exactly.
A bit of a gray area.
It's a bit of a gray area. It is. And it's important for us, I think, as a society to approach these advancements with a critical and thoughtful perspective. We need to promote healthy and balanced views of body image.
I completely agree. It's not about like judging anyone's choices, but rather encouraging those open conversations about the motivations behind those choices.
Absolutely.
Like, is it about feeling confident and comfortable in your own skin, or is it about chasing some unattainable ideal?
Exactly. And it's crucial for healthcare providers to have those honest conversations with patients, too.
Right.
We need to make sure people understand the risks and benefits.
Yeah.
And that they're approaching these procedures with realistic expectations and a focus on their overall well-being.
It's like liposuction can be a great tool for body contouring.
Yeah.
But it's not a magic solution for happiness or self-acceptance.
No.
Those things have to come from within.
Absolutely. You hit the nail on the head. It's about empowering individuals to make informed choices that align with their personal values and goals, not just succumbing to those external pressures.
Well said. This deep dive has been so eye-opening.
It has.
We haven't just explored the science and the techniques of liposuction, but also the bigger picture.
Yeah.
You know, its impact on our individual perceptions and on society as a whole.
It's been a multifaceted exploration for sure.
Yeah, liposuction is clearly more than just a cosmetic procedure.
Yeah.
It touches upon those deeper issues of self-image and societal expectations.
It does.
Absolutely. And as we wrap up this deep dive into liposuction, it leaves us with one final thought-provoking question to ponder.
Okay.
As liposuction continues to evolve, how will it shape our understanding of beauty, body image, and self-acceptance?
That's a good one.
It's a question worth reflecting on.
It is.
Thanks for joining us on this fascinating journey into the world of liposuction.
It's been my pleasure.
Until next time, keep those brains buzzing and those learning adventures going.
Until next time.